Hi guys, this is Dr. Sattar from the YouTube channel Doctor to Help. I am an internal medicine doctor, board certified, practicing in Texas. Hope you're all doing great wherever you are. Thank you for joining me today. Today is March 21st. We are going to talk a little bit about obesity and mostly about intermittent fasting. Do you know what was March 4th? It was the World Obesity Day. Obesity is an epidemic in the whole world. Why is that? About 2.8 million people die every year from obesity. That's an epidemic, and we need to address it today, not tomorrow. According to CDC statistics, 40% adults between the age of 20 to 39 have obesity. Between the age of 40 to 59, it's about 44.8. Above the age of 60, 42.8. That's horrible. According to the World Obesity statistics, about 2/3 people are obese or overweight. According to WHO in the European region, 1 out of 3 adolescents or at the age of 11 and above, people are overweight or obese. So we really need to address it today and not tomorrow. So today we are going to talk about intermittent fasting. What is intermittent fasting? It means you fast a certain period of day and the rest of the certain period of time you are eating. There are 5 to 6 different ways of doing it. The most popular one is 8 and 16 hours. But before we go on that, let's talk about the benefit of intermittent fasting and why does it work. So, you know when we eat food, all our food breaks down into glucose, right? And this glucose gives and provides energy to our cell. So anything that's in excess, yes, we are all eating more than we need to. That excess energy or glucose is stored in liver and muscles. Once that storage is replete, the rest of it goes to the adipose tissue. So when we are doing intermittent fasting, the first 12 hours, since there's no source of energy from food we are eating, the glycogen from liver breaks down into glucose. And that's the energy, that source that the cells will utilize first. Once the 10 to 12 hours is over, in an inactive person, the body starts breaking down adipose tissue. That's the fat tissue. It's broken down into fatty acids that goes to the liver, produces ketone bodies, which is then used as energy for the cell. So when we do fasting, intermittent fasting, that's how we are depleting all of our extra fat. And that is very important in intermittent fasting. So this is the mechanism for intermittent fasting and how we lose weight. So what are the benefits of intermittent fasting? We lose weight. It lowers blood pressure, blood cholesterol. It increases good hormones like growth hormone, norepinephrine. It increases neurotropic factors that helps with production and support of neurons that helps in development of brain tissue and keeps away Alzheimer's disease. It also reduces chronic inflammation that protects from diseases and cancers. So these are all the benefits of intermittent fasting. Unfortunately, not everybody can do this. These are contraindicated in people who have chronic health illness such as renal failure, heart disease, people who have brittle diabetes, type 1 diabetes, and hard to control type 2 diabetes, pregnant, children, adolescent, and people over the age of 70. Also, breastfeeding moms, we already talked about pregnancy, and people who have eating disorder like anorexia, bulimia, binge eating disorders. All right? So those people, we will not recommend doing intermittent fasting. If you have chronic health issues, you should talk to your doctor, your regular doctor, before you decide on doing intermittent fasting. Okay? So, what are the different types of intermittent fasting? There are about 5-6 ways of doing it, but the most popular one is 16 and 8 hours. You fast for 16 hours and you eat for about 8 hours. Usually, people who skip breakfast, they're the ones who follow it. So you have your last meal of the day at 8 p.m. Overnight, you are sleeping. You will skip breakfast in the morning and you have your first meal at noon. So during this time, are you not going to do anything? You can drink water. You can have water, 0-calorie fluids, coffee, and tea. Those can be allowed during this fasting hours. In the 8 hours that you eat, you of course want to eat healthy food, whole grains, avocados, coconut oil, green leafy vegetables, whole grains. These are the food you want to follow. Work within your budget. You want to try to get grass-fed protein like meat. There's no more organic rather than inorganic, but of course work with your budget. If nothing else, you can at least do whatever you do in your normal life and just skip the morning meal. When you skip the breakfast, you're actually skipping about 20 to 40% of your calorie intake in a day. And that's how you're reducing your calorie. You're also fat burning, and that's how you're losing the weight. Okay? There's another way of doing intermittent fasting is alternate day fasting. So you fast one day, next day you don't. Again, you continue the cycle. There's also another one called warrior diet. In that, you have one large meal and the whole rest of the day you only eat fruits and vegetables. That's it. There's another one that's 5 days of eating and 2 days of fasting, and those 2 days you only eat about 250 calories times 2 for women and 300 calories times 2 for men. So these are the ways that they are doing it. So please remember, you want to talk to your doctor before you start. When you start doing the intermittent fasting, you probably want to start with shorter time, like 10, 12, 13 hours, as much as you can, and then gradually go up 1 hour a day. Do what your body can do. Also remember, you also want to exercise. Best thing to do is combination of diet, intermittent fasting, and exercise. When you exercise more than 35 minutes a day, your brain releases endorphins. Those are the happy hormones. It makes you happy. And when you combine it with your intermittent fasting, you have a steady base level energy all day long. So it's very good. Your brain is also in focus because insulin level is down. Your brain can focus more. So those are the things that are beneficial from intermittent fasting. So combine your diet and exercise and do some intermittent fasting. You want to wait at least 30 days before you give up. You want to make sure it's working for you. Not everybody has the same metabolism. So think about the metabolic rate. So everybody's body will act differently. So you want to see which type of intermittent fasting suits you. Give it at least 30 days before you give up and say that it's not working for me. Usually it takes about 6 to 8 weeks. All right? So please remember all those when you're doing your intermittent fasting. Again, a reminder, 2.8 million people die every year from obesity. On March 4th, the slogan was, everybody needs everybody. So we don't want to lose even one single life for obesity. So let's prevent obesity, and that will prevent diabetes, heart disease, and cancer. So we want to prevent all that. Let's fight against obesity today, not tomorrow, not the day after. Thank you again for joining me. It was a pleasure. Until we meet again, I wish you all a wonderful day. Take care. Bye-bye.